This is Dr. Michael Brisman, neurosurgeon from Long Island, sharing with you some interesting cases of mine. This is a patient, a young woman, who had sudden onset of a bad headache. This is her CAT scan image, found to have a spontaneous hemorrhage bleed within the left lateral ventricle. Not a big bleed, did not require ventricular drainage. And she was observed in the hospital and ultimately was discharged. But obviously an investigation began to try to find the cause of the hemorrhage, and imaging, MRI, and angiogram showed an arteriovenous malformation, an AVM, that was partly within the left lateral ventricle. This is the angiogram image showing the nidus of the AVM itself, the feeding artery, the draining vein, and this is the nidus. And again, because this had bled, this was a young woman, it was a small, deep AVM, we felt that appropriate treatment once she was discharged from the hospital and she was feeling better was gamma knife treatment, 1-day treatment, and super focused outpatient radiation treatment. So this is again showing the MRI that revealed the AVM blood vessels themselves within the lateral ventricle. Once the blood is gone, you can see it better here. Here it is here, the nidus of vessels within, and this is the dominant hemisphere as well, which is going to make surgery more complicated. And here's a coronal T2 weighted MRI showing, again, the AVM nidus that is in the left frontal lobe and partly within the lateral ventricle itself. So here's the day of treatment. These are some post-contrast axial MRI views, and the yellow is the 50% isodose line plan for treatment, and showing again how we're able to very tightly conform the treatment to the nidus, to the tangle of blood vessels itself. At the day of treatment for planning, we use a post-contrast MRI and a cerebral angiogram. And so treatment went very well. She went home the same day, did well. This is an image a year and a half later. Now, the smaller the AVM, the quicker it goes away. So some bigger AVMs may take 3 or 4 years to go away after gamma knife, but the smaller AVMs can go away sooner, and we tend to give them somewhat higher doses as well. But here's the axial T2 MRI showing the AVM is essentially gone. This is after a year and a half. You can barely see it on this image. Here's another image again showing the ventricle, which now is free of nidus. So again, I think this is a nice case of a small, deep AVM that had hemorrhaged in a young patient who did very, very well with a minimally invasive outpatient gamma knife treatment, did not require embolization or deep craniotomy to try to remove this from the dominant deep hemisphere. And patient did very well, was very happy with things. So just want to share with you this interesting case. Thank you.